Are we recording?
Mm-hmm.
All right, so this is for Mary, Bowling Green. And anyways, this is Nicole. I've known her for a long time, since she's my daughter. ACL reconstruction in October. But I'm going to show you the first things you do when it's acute. Essential oils, we'll talk about that another time, because they help heal. And so one of the things we've been doing at the practice here the last couple of years is using these to great effect. So swelling is our one thing that we have to go after. I need some oil, because it's somewhat the enemy at this stage. We want to drain the garbage out of this knee. So you're going to need some massage oil. If you guys don't have any, baby oil will work, olive oil will work in a pinch. And while the wounds, if they're still somewhat scabbed over, you could avoid going around them. By going around them, you wouldn't want to go right on them with a fairly deep massage until you're sure that they're pretty solid. So if he's just getting his sutures out or the steries are off, then you would go around those wounds, but you would still do the cephalorage, this draining technique, which is up towards the heart. Notice we're on a bolster, so that the knees above the heart helps to drain this away. And the first 2 to 3 weeks after surgery, it's drain the garbage out of the knee. A lot of it settles in the back of the knee, popliteal region. That's someplace you make sure you work, because that will cause trouble down the road. Okay? So lean on them so that your hands can tolerate doing this 15-20 minute work. And over the years, all of us here, we just know how to lean and use our body weight to do this massage. How's it feel?
Good.
Always feels good. We always start like this. So Nicole is a couple months into it, but all the massages always start with this technique to drain. Sometimes you can go and say, well, I'm going to get any of this swelling in the quad out and work that first. And after you've done that, then you come here and move into the knee, because you've drained into the quad. And if necessary, you'll sometimes see ACLs with some swelling even down in the calf. So get it up and out, get it moving. As they say, lean on them to get enough pressure. One thing that you may be hesitant to is enough pressure. You got to make sure you have enough in order to be effective. Okay? So that's the first couple weeks. A minimum 3 weeks for soft tissue to heal. Like the wounds take about 2 to 3 weeks to fully heal. Think about some of the other soft tissue disruption as he's got to cut through the capsule and the muscles and dissect down. Those structures need 3 weeks. And it's at 3 weeks you can then start to get a little more vigorous with doing this deep tissue work. So, if you'll do this, and then you can also just do a little bit of work, because it's universal. ACLs have tightness in the back of the knee, and they also have tightness in the calf muscle. Even to this day, Nicole has some tightness in here. This you can get working on right away with just doing some of the deep tissue work all along the calf. That's like kneading bread. Okay? So that would be something that you can work. Sometimes the hamstrings will be tight. And you get working deep in the hamstrings. And you'll find that some restrictions are because of all the stuff that stagnates back here. So make sure, even at this early stage, you do work hamstrings, popliteal, back of the knee, come down into the calf. And work those all out. Please notice, I'm always pushing all that garbage we loosen up into the quad. Because the blood flow is great here, dissipates a lot much easier in the quad than it does stuck in it. Okay, so that's the first couple weeks right after surgery. The main goal Drain the garbage out of the knee. Get it out. Increase blood flow. Not a lot of deep tissue work yet, where the soft tissue has been disrupted. 3 weeks, slowly but surely you start into it. Then you can come around where you've got some tightness right where the scars are, point tenderness. If they have some medial collateral issues at all, you can certainly go and start to dig them deep at 3 weeks. Now that's one where their eyeballs are rolling the back of their head. And if you don't get the response, you're probably not going deep enough. So when you know the wound is solid at that time frame, you can get right on those scars where the portals are, where the harvest scar is. Dig deep. We rarely have to mow patellas because we're so good about going after this right away. And if we do, of course, then, it's just a matter of getting that 15-20 second stretch left to right, lateral, medial on this patella. But we rarely encounter any problems because we're so aggressive in getting rid of the swelling first, then modulating the scar tissue as it forms. All ACLs in our practice get this 20 minutes worth of work. First thing. First thing is some heat and stim, then ultrasound, and then this most critical thing we do is hands-on. So when the patient says, athlete says, it's a little tender right here, that's the spot where I know I'm going to work on. Okay? Any sore spots? You always got it right here at the scar. So Nicole has some issues and some soreness deep right here, and I get deep. This is not, medical massage is not comfortable massage. This is some screaming meanies now and then, and that's just the nature of the beast. But when we're done, mobility is better, swelling is reduced, scar tissue modulated, muscle spasm is lessened. So it is possible to just accelerate so much and actually get the graft to heal better if this can be done a couple days a week. Now I, as a practice and the gang here at the office, always are looking for loved ones, and we say, here, this is what you got to do. Even if they're rookies, it's better than nothing for them to actually do some of this for the loved ones at home. For some of this muscle tightness, sometimes we do trigger point work. And that is, find that tender spot. There's one. And now you can't see per se, but I've got that spot. I saw our eyeballs jolt a little. I know that's tender. I'm just holding it here till we fool these muscle spindles and Golgi tendon organs to figure out we know what we're doing, and then they relax, and then the muscle is less spastic right there at that spot. And how do I know? Patient tells me pain is less. Has it gone away yet? Mm-hmm. I can move a 1/4 inch, 1/2 inch. A little spot there, isn't there? Not too bad. Oh, there's a spot. And you just search and destroy. Hit these tender spots, and it's amazing how much those muscles will relax. Now, I'm holding just as much as I start. I wait 30 seconds. Sometimes you can feel the muscle relax, but you always confirm that pain gone now. Yeah. Pain's gone. Portals, you can do the same thing if you find some tender spots here or some muscle tightness in the quad, even along the side of the patella. You can do trigger point work all through here. Just another technique to help modulate pain. Get rid of the swelling, modulate the pain, normalize gait sooner than later, and man, then things just go so much quicker. Did I miss anything, Mel?
Nope.
You doing good?
Mm-hmm.
So Nicole comes in now several months into rehab. We just do this before she starts her workout. 4 months? 5 months now?
It'll be 5 soon.
4.5 months. She's running a mile?
And a mile and a half to do.
Mile and a half. Normal motion, that's the thing you emphasize. which is why the pool works so well. So as soon as the wounds are healed, our ACLs are in the water. And they're bearing weight. As soon as they can get in the water, water's chest high, no compromise of the weight-bearing status, but all this ability to move equally compared to the uninvolved leg, and they just have this body remembers, I know how to do this. So our kids are jogging at 6 weeks, but they're in the water. And they just say, you be normal. Everything has to be normal. As soon as we go dry land at 2 months, if there's any hitch or any limp, we get rid of the pain, and then they go back to being normal. So everything has to be in a normal fashion. And you've got a good leg, that's the teacher. The involved leg is the one that tries to be normal. And the kids can, okay, be normal. Just watch the quality of their motion. Sometimes, to help with some mobility, I'll do a distraction. Now, this technique is, I'm just going to show you this further down. If you get someone who's pretty sore, you want to take some pain away, you can do some contract relax. Contract relax would be, now Nicole doesn't have this issue, but if they were struggling with some flexion, let's say they were at 115 and you need to get a little further, the technique is Nicole's going to push her foot up towards the ceiling. I'm blocking that. Doesn't have to be a lot, just enough to get the muscles to contract. I don't allow any motion there, and now relax. Once she relaxes, I can give a little bit of a distraction. I'm pulling the tibia away from the femur, and now I'm going to give a little bit more push down, and when she screams out, I go a little further. So you're not going to injure the graft. You're just going after all this stiffness around the other structures. Do that twice, so she would push up again, hold that position. 6, 7 seconds, now relax. And then I can give her a little, she can engage hamstrings to help do this, and I can give a little extra push to be able to get more flexion. To take the pain away completely, try to take her leg off her femur. Pull. Again, you're not going to harm any of the repair, but they'll be happy with you again, because you can take the pain away by doing distraction of the knee. So I've got my elbow tucked in my waist. I am stabilizing the bottom of the femur, and I'm giving a good tug on the ankle, and that just pulls, and they love that. It takes all the pain away. Extension would be the same way. Virtually. Do some retract, relax with extension. So they're missing some degrees. Bend your knee up. She's trying to flex the knee. I'm not going to allow motion. Now relax. You can have them engage their quad. Go ahead, try to straighten down. And while they're trying to straighten the knee, I'm just going to give a pull here, push down, get that extension back. Do a second time. Go ahead, push up. And I'm not allowing any motion. Now relax. Just try to straighten. And as they scream out, you know you're doing it right. Can't. The knee went all the way straight following surgery. Surgeons always make sure they got full motion, and then let me finish this. So I can also distract on that extension. I'll let them know as soon as you work extension, flexion will get stiff. It's just the way it works. You work flexion, extension will get stiff for a moment. They'll think I'm going backwards, but they're not. They're getting each side. And as a consequence, the other side of it is stiff. That's just the way it is. But if you work all of these, they always end with extension, because extension is the best one for them to feel when they get up and finally walk and they go, oh, and you feel so good. But what I'm telling you is that after the surgical fix, the knee was ranged and it was full, and he has all his motion. The surgeon is great. So the knee went straight and the knee flexed. And then they wake up and they realize, oh, there's pain, and that's what's stopping them. So you can go and push and get some screaming meanies from them and feel confident you're not going to hurt anything. So get started with that. Watch that. Get your questions. Let me know what it is you want to talk specifics on. Your hands do the walking. They'll figure things out. It's in you. If you want to learn to be a healer, you just got to touch enough of these to know that this is what will work. And the confirmation you'll get is that feels so good. You'll get off the table and go, do that again to me. And, you know, they'll want you to, they'll line up once you start doing whatever it is, shoulders, knees, ankles, with this healing stuff. Okay? All right. Thanks, Mel.